I'm going to talk about the aspects that are needed for nursing as a nurse, staff nurse in your practice. So the final talk today we are going to talk about is on dietary advice for NCDs. We had a very fruitful session this morning, so we are going to end with the diet. So why should we talk about diet? Because as nurses, you are the people who are dealing mostly with patients in the ward, especially in the wards, because the doctor spends a very small time, but you see you give them medicine, you talk, you are the ones who spend a lot of time in the ward, so you get to move with the patients a lot, and then the relatives also come and ask you a lot of questions about what about the diet. So knowing about the dietary advice is very important, and it's through you that most of the dietary advice that patients and the relatives get. So the importance of why we need to talk about specific dietary advices for different diseases is like two main things. One is like the nutritional requirement of different conditions are different. And then the complications that they get are also different with different conditions. And then like we'll say just diabetes, a diabetic patient who has a BMI of 40 needs different advice compared to another diabetic patient who has a BMI of 18. So you can't use the same dietary advice that you give for diabetic patients to those two patients, because it needs to change with the BMI and everything. So when you are like giving dietary advice, it's important to first do a proper nutritional assessment to see actually like what's their BMI, whether they have nutrient deficiencies, so it's not just for diabetes, it should be customized for that diabetic patient. That's the first thing. So like the most important thing is keeping everything in the mind always is not easy, but then first thing is like we need to know what a normal diet is, and then adjusting that to different conditions is easy, right? So a normal diet, you will all know, but just to emphasize, like the fat content should be less than 30%. So so we have to try and avoid all the saturated fats, like unsaturated fats, like plant-based fats, and then so you know the saturated fat is the one that gets hardened when you put in a fridge, so if we put coconut oil, it gets hardened. So likewise, so polyunsaturated fats are the fats if you take olive oil, if you put in the fridge, it does not get hardened like that. So if we can avoid saturated fat, that's better. And then talking about sugar, we have to try and avoid sugar as much as possible. There is no need of taking sugar for anybody. Some people do think we should take some amount of sugar, but if you can do away with sugar, that's also okay. We have to try and get it below 5 to 10%. And salt intake, the normal intake is 5 grams. So that means the normal allowed is 5 grams is 1 teaspoon, level teaspoon, right? Table salt. So the intake should be less than that for any disease, right? And then we know that fruits and vegetables, we need to have at least 5 portions of a day for it to be healthy. And the protein intake, we say it should be between 10 and 35% of the total intake. Now, so WHO has developed a principle of a normal healthy diet, because now everybody can't be eating rice, mallung and paripu always. There should be some variety as well. So yes, it should be a balanced diet, right? But then it should be diverse as well. There are enough different vegetables, different mallung and everything that you can use likewise. So it should be diverse as well. right? And it should give you in adequate nutrients. So it's like, I mean, if somebody is have BMI is low, you need not cut down the carbohydrate intake. So like, I mean, it should be adjusted to that person. And then once in a while, you will have to adjust some, give them some allowance to take, like unhealthy foods again, like there are some situations you have to take. So like, so proper diet is like, I mean, everything should be there. Now what I'm going to do is I'm going to take you through different dietary advices that you can give for these like diabetes, like chronic NCD conditions. Now if we take diabetes, as I told, like why should we do that is like if somebody is pre-diabetic, if you ask them to reduce carbohydrate, reduce all the simple sugars, then they can, like they will not go into diabetes, or like, I mean, they can either delay development of diabetes. So in diabetic patients, why should we do that? It will give a good glycemic control. And so what it does ultimately is like it will reduce or prevent or delay development of chronic conditions like peripheral neuropathy and all the diabetic complications. And it will definitely reduce the acute complications like diabetic ketoacidosis, like acute complications. And then like, I mean, maintaining a healthy BMI is important. You need muscle mass and everything. So it's a balance that you need to achieve. So for that, what you need to do is like we have to ask them to try and reduce foods with high glycemic index. So the high glycemic index means like the simple sugars, wheat flour, like the white flour, likewise even the white raw rice, because that gives a quick, like the carbohydrates get absorbed to the blood and then the blood sugar goes sky high just after a meal. But then if you take like parboiled rice or red rice, what happens is there is a lot of fiber in it, so the transit time in the gut is more and the absorption is slow, so that there won't be a high peak of sugars in the blood. So that is something we have to advise them. So increasing fiber is important, and as in any normal diet, vegetables, fruits are good. And then alcohol should be avoided, because like alcohol is like if you are drinking sugar, because it's made with like what it ultimately gets converted to is to glucose, right? And then we have to advise them to take meals on time and should not skip meals, because like you are giving medicine at different times, and then like the meal pattern also should be adjusted to that, especially for diabetic patients who are on insulin. So this is the American Diabetic Association diabetes plate. Again, like, I mean, it's not that different. So vegetables and fruits, half of the plate, and then carbohydrates, it's good if you can reduce it to quarter of the plate, and proteins, quarter of the plate. Right? Moving to diet in hypertension. So the recommended diet is called DASH diet. So dietary approach to stop hypertension. So what it essentially says is like, I mean, we have to reduce salt intake. Salt is the culprit, like the thing that we can reduce to get rid of like reduce blood pressure, right? So normal intake, I said 5. So we have to, like, I mean, ask them to reduce it less than 5 grams. So one person can consume less than 1 level teaspoon of salt. And then, like, I mean, so all the other things, like we have to try and reduce sugars, because like thing is like it's not hypertension only, diabetes, hypertension, hyperlipidemia, all those are interconnected. So like, I mean, controlling all those in one go is important. And then red meat, fat, because like red meat, they do contain a lot of fat as well, so try and avoid all the saturated fat. And then what this DASH diet emphasizes on is like try and move on to plant-based proteins and lean proteins. Lean proteins means where there are good quality proteins and there is no fat in it. Like, so it's like chicken is lean protein, whereas beef, pork are red meat. So those are the bad proteins, right? And then we have to increase the vegetables, fruits and whole grains in our diet. So if we reduce sodium, reduction only can get down about like a systolic blood pressure drop by about 5 and diastole about 3. So that's a lot, right? So this is the DASH diet plate that is recommended. So not so different. It's again like similar to the diabetic diet. Salt reduction gets more prominence in that, and plus plant-based proteins and lean meat is what is recommended. Then if we move on to diet in hyperlipidemia, so we know the problem is high cholesterol. So we have to try and again reduce the cholesterol, the fat intake. So normal fat intake is 30% of a plate. So we have to try and reduce it. And then especially we have to avoid trans fats. So trans fats means like the fats that we find in like pastries, fried food, fast food. And then what we say, like we should not like reuse the oil. Like, so fried oil should not be used again means because the oil, the coconut oil, we say is okay, but if you reuse it, what happens is the composition of that changes into trans fat, so that it becomes not good. And then again, the carbohydrate intake also should be reduced, because like what happens is when you eat a lot of carbohydrates, the rest the excess gets preserved in the liver and all the organs, it gets converted to fat. And then we have to increase the dietary fiber for any condition, like because it reduces absorption. Fiber has lot of good benefits. Again, for hyperlipidemia, so what we can say is like, I mean, the things that people can take is they can eat fish, they can eat chicken, and they can eat egg white. Egg white is a very good protein which does not have a single fat content in it. It's the egg yellow that has fat, but egg white is pure albumin. So if you eat egg white, that's a very good protein, and it will not give fat. Like, I mean, it doesn't have fat, so that's a very good and more the cheapest protein source for Sri Lankans, I think. Right? Now coming on to CKD, so the dietary advices again in here depends on like the nutritional status of the patient and their metabolic abnormalities, and they're like the stage of renal failure that is important, right? So again, the recommendation should be individualized. Again, you have to assess the nutritional status, what the other comorbidities they have, the stage of kidney disease, and the complications. So if we go one by one, like I mean, so protein intake, the latest recommendation is to reduce low protein diet, but it doesn't say no protein diet. So it's a low protein diet. What the recommended is, like, I mean, they can again eat like lean proteins and plant-based proteins, like matched, like the guinea petty size, matchstick box size. So they can take either fish or even chicken, guinea petty size piece for like even all 3 meals. But it's better if you can replace plant protein, the animal protein with plant protein, or like, I mean, avoid red meat. That is the recommendation. Right? And then, but if somebody is on regular hemodialysis, then that, like, I mean, they can even take a little bit more protein because like they are on dialysis. And even in Sri Lankan diet, we are not like compared to Western diet, our protein intake is anyway low. So like, I mean, there's no need to ask them to cut down their protein intake quite a lot, because we don't eat like very big pieces of chicken in Sri Lanka. And then coming on to fluid recommendation, it again depends on the stage of the kidney disease, their urine output, and whether they have edema, likewise. So it depends. So somebody like, I mean, if there is edema and if that patient is not on dialysis, we might have to restrict fluid. So likewise, it depends on the status. Then talking about dietary potassium, it's again, if they have high potassium only, we have to ask them to restrict potassium. Right? So to restrict potassium, what we say is, as you all know, to avoid fresh fruits and vegetables, but that's again if there is high potassium. And then like, I mean, if somebody is having low calcium and high phosphate, then we have to like, I mean, so then in that situation we do give calcium. So the recommended calcium is calcium in carbonate composition, because that can reduce phosphate level in the body. And then if we are giving vitamin D, it's not just the vitamin D, we have to give the 1-alpha cholecalciferol, that is the activated vitamin D. And then like, we have to always ask them to avoid high phosphate containing food. That is important. So the food with high phosphate are like meat, carbonated beverage like Coca-Cola, cheese, Marmite like products. So they should be avoided because they have a lot of phosphate. And then if there is high uric acid can damage kidneys. So like, so you should not take beer has got a lot of uric acid, and lot of red meat do have uric acid. Usual recommendation is calcium. It's a normal calcium diet, but if somebody has CKD due to high calcium, then you will have to reduce the calcium intake. And reducing salt is again important. Half of the tablespoon is what is recommended. Sorry, teaspoon, right? Now, coming on to the last one, chronic liver cell disease, again, like it depends on the status. So poor nutrition, like we have to give them calories, because otherwise what happens is all the muscles get catabolized, and then the ammonia level in the body goes up, and that can even precipitate all the encephalopathy. So we have to give them adequate carbohydrate intake as well, right? And then they have anorexia, they can't eat. So like, you have to adjust your recommendation accordingly. But you don't give high protein because it can worsen encephalopathy. So what we recommend in so the Ragama, the liver unit is like, I mean, you can take protein to all 3 meals. Even like the palm size piece of chicken or fish or egg white can be taken. So 1 meal a day with animal protein, and the other 2 meals with plant proteins like paripu or something like that, right? Soybeans. And then salt again need be reduced. Our recommendation, what we say is to cook without salt, and then the amount somebody can use per day is again 2.5, so less than half a teaspoon level teaspoon. So keep it in a small container, and when you eat at the table, just put salt to your food so that you can eat. Like without the salt taste, you can't eat. So like, not for you not to eat a lot, that's the recommendation. The other things, as I told you, like protein restriction, especially in acute liver failure, hepatic encephalopathy, we ask them to restrict protein. And then because the liver reserves are poor, their vitamin B levels can be low, so we can give them vitamin B. Avoidance of alcohol is important. So in summary, what we need to know is like, I mean, dietary recommendations are needed that should be tailored to the patient's condition and their body's habitus, body's status, and for the complications they have, right? So initial nutritional assessment is important before you give the recommendations. And the aim is to like prevent complications, both acute and chronic, and treat, give a, improve their nutritional status. So the general rule is stick to the healthy plate and adjust the proteins and the salt accordingly, and the fluid according to their complications. Okay, thank you.